Well, hello everyone. My name is Jennifer Larson. I'm the training coordinator for the Office of Community Living. I just wanted to go over a few housekeeping items with you today. We are recording this session, so we do ask that you be careful when you're asking questions or putting information into the chat to avoid sharing protected health information or PHI. We are using the chat panel to manage your questions, so please type those in as you have them. We also will have a few times during the presentation where we'll pause and allow you to raise your hand and ask a verbal question if you choose to do it that way. I will make these slides available to you on the Transition Services Resources page where we have other training out there available. The slides are not there currently, but I will put that link in the chat so that you can keep that in mind, and we'll get that out there shortly after the presentation. If you are listening by phone today, you can press *6 to unmute your line or *9 to raise your hand, and we'll be able to call on you. And Zoom does have closed captioning. If you press the closed captioning button at the bottom of your screen, you should be able to turn that on or off. And with that, I'm going to go ahead and turn it over to Chanel to start the presentation.
Thank you, Jen. Hello, everyone, and welcome to the Group InReach training. My name is Chanel, and I am the InReach Unit Manager. Also on the training today with me, I have a few of the InReach coordinators. So they'll be trying to answer some of those questions or concerns that come up in the chat as we go through the presentation. And then we'll also, like Jen said, have time during the presentation to pause and take questions then. Great. Next slide. For today's agenda, we're going to go over the definition of group InReach, and then we're going to talk about the expectations. We'll talk through the regional resource document, which is a new deliverable for the options counseling contract. And then we'll also review some of the tasks and the timelines. Next. So group InReach definition. The state defines group InReach as actively seeking to engage institutionalized population members and provide them with full and accurate information about housing services and other community-based services as an alternative to living in the skilled nursing facility. During group InReach, the counselor will respond to any questions or concerns raised by the member or the member's unpaid support and provide referrals to other agencies as identified by the state. Those agencies will help members meet their needs in the community, and group InReach should be in addition to the community engagement provided by the contractor in the regional outreach plan. Okay, next. So the department would like to partner with ADRCs to accomplish goals that will benefit skilled nursing facilities, residents, and the facilities themselves, ADRCs, and the state as a collective. The goals we hope to achieve are to actively support institutionalized population members in making an informed choice about transitioning into the community, establish a sustainable contract between the department and options counseling agencies while reinforcing relationships and collaboration with skilled nursing facilities, case management agencies, regional accountable entities, and or the other organizations. Next. We would also like to accomplish for the skilled nursing facilities, we're hoping to provide them support and ongoing education to the staff about transition options, waivers, and programs that the state offers, and assistance for the department to obtain proven documentation of implementation of programs that support members' choices to live in their preferred setting. We are only able to achieve these goals if we can collaborate on process development, documentation, and communication. We are ecstatic to be able to partner with you all to expand on the work you have been doing already and look forward to growing this program into an ongoing resource for members and their families and other supports. So now we're going to just dive into the tasks associated with Group InReach. There are going to be 4 overall tasks for Group InReach. They are coordinating Group InReach with skilled nursing facilities. You would do this 2 times a year or every 6 months. Our hope is that you would at least have a 4-month gap in between your first and your second Group InReach, but no more than 6 months. Complete the presentation at the meeting, and then complete any referrals for members. And then finally, you're going to complete and submit a deliverable to the department through SharePoint. I plan to talk through each one of these tasks before I get started, but are there any questions up to this point?
And as a reminder, you can use the raise your hand feature in reactions to raise your hand if you'd like to be called on.
All right, hearing none, I will keep moving forward. So step 1 is going to be to coordinate with the skilled nursing facility to set a date for your presentation. As many of you know, the HCPF InReach team has completed Group InReach with almost every skilled nursing facility in Colorado. I believe we have 1 region or 1 city left that we're planning to do this month. Our hope is that we have met with and shared the expectations for skilled nursing facilities enough over the past year that when you all make contact, they are aware of the program and why you're reaching out. You can coordinate with the skilled nursing facility via phone, email, or in-person meeting. We ask that you maintain documentation related to your communication just in case an escalation needs to occur. In our experience, emails followed up by a phone call have been most effective. Once you and the skilled nursing facility have confirmed a date and time for Group InReach meeting, the skilled nursing facility needs to reach out and communicate with individuals in the skilled nursing facility, including but not limited to Health First Colorado members and their unpaid supports and or guardians. We will share a letter. It's called the Skilled Nursing Facility Group InReach Family Letter that we used this past year to provide to the skilled nursing facilities when they invite members and their supports. You can share the letter or not, and feel free to make your own for what works for your region. It is best practice to follow up with the skilled nursing facility both the week before and 2 days before the scheduled meeting to ensure they have not had any changes and are prepared for you to attend. Also, if the skilled nursing facility interferes with scheduling, we would like for you to submit an escalation report within 30 days of the attempted scheduling to the department via our team email, which we will share at the end. So escalation needs. Prior to submitting an escalation, we ask that you complete and have documentation of the following information: a list of attempts, calls to the nursing facility social service director. We'd ask that you do at least 2 calls to the nursing facility administrator, also at least 2 calls, emails to the nursing facility social service director or the administrator, hopefully 3 total, the date and time of an in-person attempt to schedule, and the name of the person that you contacted. And then, as I was saying, you can send any of those escalations to our HCPF email, which is right here in the slide. And the email address is also on the very last slide. Okay. So the second step for providing group inReach is going to be the presentation. Your agency will need to develop a presentation for members with information about state long-term services and supports and any region-specific resources. HICPUF has developed a sample presentation that you may build on or use with the additional regional specific resources you have. We understand that not all facilities have the capability to have a digital presentation, but we would like for you to have one to ensure the continuity of information being shared across the state. HICPUF has also developed long-term services and supports brochures to distribute to individuals that attend. And then lastly, ensure the transition services posters and or flyer is displayed in the skilled nursing facility with your agency's contact information. Okay. So, oh, there they are. So this is the cover of the brochures I discussed previously. Any of you that have visited or came and seen one of our group inReach presentations probably snagged one of these. But they are online, and you'll see that there are several brochures available in both English and Spanish. You can access them under the main transition services page on the state website. You can also review additional information by going to our new webpage, learn about long-term services and supports. There you'll see short videos and also program waiver specific brochures. HICPUF plans to mail a starter batch of brochures to each agency with a plan for your agency to supplement these needs in the future. So just be on the lookout for a box coming from HICPUF with these brochures. You will get both English and Spanish brochures for your agency. Okay. And then I also spoke about the posters. So these are the example of the posters that you would see in the nursing facility. The poster on the right is the original poster that most skilled nursing facilities will have. It was kind of large, and so we received feedback that maybe there should be a smaller option. So the poster on the left is the smaller option. In either circumstance, you will need to add your agency's contact information and just ensure that that poster is hanging in your skilled nursing facility somewhere. We've asked that it be hung near the ombudsman posters, but just let us know if it's not there or if you're struggling with a nursing facility not posting it. They are required to post it under the federal resident rights regulation. So if you're having that issue, let us know and we can support that. All right. When you're developing your poster or your presentation, there are going to be a couple of elements that you're required to have. We want you to talk about long-term home health, long-term services and supports, the minimum eligibility requirements, overall HCBS waivers, state services and supports, transition services, a high-level timeline for obtaining services, for example, from group inReach or options counseling referral to the TCA. They have about 10 days to contact the member. So we just want to make sure that you're sharing that information with the members that you're talking to during group inReach. We ask that you share an overview of all the state programs and region-specific resources for your community transitions, even if they're not available in your area. So when we were out, there were times where it was like, oh, we don't have that here. We still want to share that information to allow that continuity, but also allow members to know that if they would like to move to another location or another region, if that's possible for them, that is a service that they could receive elsewhere. sorry. Keep in mind that your main focus is to educate the attendees of services and supports available. We do not expect or encourage you to screen out any person or give feedback on their specific eligibility. During our group InReach presentation, we have run into individuals that do not have Medicaid, but are interested in transitioning. Our hope is that you all can connect them to resources through the ADRC or AAA. And then, so I just wanted to take a moment to check in about questions so far. All right. So moving on to step 3. So
Now we do have a question in the chat. When should we expect the brochures to be delivered?
um, I will have to follow up with one of my teammates. I know that we checked and they are approved. And so we should be getting them delivered soon, but they're not coming from HICPUF, they're coming from the printer. So I can't give you a specific date, but I would hope in the next like couple weeks. At one point when we ordered stuff, it came fairly quickly. And then the last time we ordered, it took 6 weeks. So I'm not exactly sure about that timeline, but I will try and follow up on that. And Sarah responded in the chat that they are being printed as we speak. So hopefully very soon in the next couple of weeks before July. Okay. So step 3, after your presentation at the skilled nursing facility, you're going to check in with each member and their guardian if they're present to see if they are interested in a community transition or not. If they want to transition, you will need to make a referral to the proper agency within 2 days, which in most circumstances, this is going to be the transition coordination agency. We are leaving the language open just in case there are other agencies that we'll need to make referrals to in the future. But like I said, right now it's probably just the transition coordination agency. If they want additional information and are not ready to make a transition right away, you all are able to schedule a meeting to complete options counseling with them. You are able to do that options counseling at the time of the group InReach meeting if that works best for you and you have time to do so. And then if the member does not want to use a transition coordination agency, we encourage you to connect the member with the skilled nursing facility social service director and document that choice on the group InReach log. Oh, and then there's also the option that they're not interested at all. You wouldn't have to do referral in that circumstance. Okay. So this next slide is just an overview of that process. So at the top, you're going to see the member attended the group InReach presentation and the 3 options. So if the member feels like they have enough information to move forward, they're going to talk to you and you're going to make a referral to the transition coordination agency right away. The option 2 is that they're not interested in transitioning. You will just document that on your transition or your group InReach counseling deliverable. And then the third option is that the member wants more information or more information specific to themselves. At that point, we would ask you to schedule or complete an options counseling meeting with that individual. And then depending on how that goes, you would follow your typical options counseling process. We are asking that any individual who goes to options counseling from group InReach that you put in a referral through the transition community request form. We're just asking that you do that so that it's easier for us to track and once you turn in your quarterly deliverable at the end of the quarter, we can see that those options counseling meetings came directly from Group InReach. Okay. And then we just have the next slide is just if the member isn't sure and you guys need to go back and do the options counseling, we just ask that you go ahead and put it into the Google form so that they can, so that we can track it a little bit better. And then we're also using that to develop the process either in the sheet or the CCM that we've been talking to you all about. So we just need to see how many are coming through. Okay. Next slide. Step number 4 is the final step, and it is going to be the deliverable of the Group InReach documentation. And what we're asking is that you develop or that you submit that to us through your LCA SharePoint site by the 15th of the month following the Group InReach. If you have questions or need to add users or make changes to whom has access to the SharePoint, please reach out to, or please have your director or supervisor reach out to me at my email, which is going to be at the end of this presentation. Your organization may collect the information for deliverables however you would like. Our team did find it most efficient to collect member information when they were entering the room or before the presentation, and then doing a circle back around at the end of the presentation to get their decision on transitions. Okay. So this is more detail about what should be included in your Group InReach deliverable. So we would like the name of the nursing facility that you completed the group InReach in, how were the individuals and the unpaid supports contacted, the date of Group InReach, the number of Medicaid members in attendance, the number of unpaid supports in attendance, the total number of members requesting referrals to transition coordination, the number of members not interested. We would also like a list of the members' names, their birthdays, if you can get them, and Medicaid ID. And then I have that advertised. And if the member wants a referral to options counseling, or if there was any interference from the skilled nursing facility, but you'll also be doing that via email to the InReach team. Okay. So any questions about that deliverable? We do have a sample deliverable that we'll share with you all to ensure that you guys have what you need, but you can make it your own or change it as you see fit. I'll take a minute to check the chat. Jennifer, go ahead.
Yeah, I'm sorry, I couldn't find the hand raise feature right quick. Did you say with these deliverables that they'll be emailed?
No, so we will upload them to the SharePoint and then
thank you. Okay, yeah, that was the clarification I was looking for.
Sorry, yeah. So we will site, and then when you are submitting them, they would be uploaded to the SharePoint site in the same process that you all use now for your quarterly. The Perfect. Biggest difference with this guy is that it's going to be due monthly versus quarterly, just so that we can kind of support those processes, especially if there's nursing facility interference, or we're noticing that maybe a lot of members are not being invited, or what does that look like? So we don't have to wait for 3 months to support you all in the community. We can do that a lot sooner with that information.
Great. And you said the due date will be by the 15th of the month following?
Yep, exactly.
The date of the Group InReach? Okay.
Yep.
Thank you.
Of course. And then I'm gonna look at the chat. It looks like we have a couple of things there. So give me a moment. Awesome. Just some chatter about the brochures. All right, next slide. Um, so I believe one of the other things that we've kind of had conversation around is an additional scope of work in the form of a deliverable. And what it would be is a regional resource document. Um, So for this regional resource document, we would like for your agency to create a document that just talks about your region specific resources. Um, and for this document, it would be shared with other agencies to support members, potential members, to give information to guardians, families, and natural supports. And then for the nursing facility staff, and then just the general public. We expect that case management agencies, RAISE, and transition coordination agencies might use this document um, to know what's going on in your region. We feel like your agencies have a better touch point with the regions, just because you're very specific to that area, where some of the case management agencies and RAISE are looking over a lot of space and area. So we would like for you all to create a regional resource document. The initial submission is due September 15th, and then we would ask you to update it quarterly on the 15th of December, March, and June. Unless it is a weekend or a holiday, could turn that into us the next business day. Okay. And then for the next, we're going to talk about the minimal information that needs to be included. So we would like information on resources that are not funded by Medicaid. So if you have any housing resources in your region, food resources, provider support resources, and then we also are going to be looking for resources for specific diagnoses. And so those could include like mental health, substance abuse, the RAY, CMA and TCA information, if there's information about hearing aids or glasses outside of what Medicaid pays for, if you have a program in your area that supports chore or minor health home repair, any health and wellness program. So if you know that the rec center in your area has a program for older adults, let's share that kind of information. Transportation support, legal services, any kind of those resources that are not funded directly by Medicaid. We would love for you to add those to this document and have it to share. And we understand that not all agencies have a website where they could post items. Just let us know how you plan to have that available for case management agencies or anyone that wants to use that. And if you do have a website, we would love to see that updated there. Okay. And so Tiffany asked the question that they have a R2A resource guide that they update and print annually. So I would have to look at it to be sure, but I think that should be fine. If you already have a document that your agency is using, just make sure that they have these other elements, and then that should work okay. And then we just need to see that it's being updated quarterly in order for us to pay out for those. Does that answer your question, Tiffany?
Yes, it does. So our Answers on Aging resource guide is pretty comprehensive, but
Okay.
like I said, the printed material, sorry if you can hear my husky howling in the background. The printed material is really only updated once a year, so it wouldn't be on that quarterly basis, but we do try to make sure that our internal resources are updated, and then it is updated, of course, for whenever it goes to print again. I think the quarterly piece might be a little bit challenging.
Okay.
That's my only concern, is the quarterly piece.
Okay, yeah, we can definitely talk about it offline. And if I don't know, Tiffany, if there's a possibility that you do it, update it quarterly digitally, but only print it annually. But yeah, we can chat through that a little bit more, just kind of offline together.
Okay, perfect. Thank you.
Thank you. So I talked about some additional tools that we are producing or we used over the course of the last year. And so this is just kind of a list of things to expect. We had a skilled nursing facility group in-reach letter that basically informed the family of why we're doing this, let them know that we were doing a presentation and welcomed them to attend the presentation with their family member. It has changed a lot through the course of the year, just from feedback from nursing facilities, some of the options counseling agencies, or family members that have reached out to just say, like, hey, we didn't understand this part, so we think we've gotten into a really good place, but you are welcome to use this letter. It is not a requirement, and you're also welcome to develop something else that works for you in your region. We are going to also upload to SharePoint our department example of the presentation. As I stated before, you can use it as is, and just add some of your regional specific information to it, or feel free to recreate it as you see fit. Just ensure that you have all of those elements that we discussed earlier in there. We are asking that you submit the presentation that you plan to use to us within 30 days of the contract, so that we can ensure that the continuity of information that we're sharing across the state is the same. And then once we've gotten it and reviewed it, you're more than welcome to use however you see fit. And then we are also producing a group in-reach job aid. For the job aid, it just gives you kind of a quick and easy overview of the process and some resources. You all received the group in-reach memo not too long ago, but we can also upload that. We've been using the memo for the group in-reach as well as a skilled nursing facility memo that we sent out early last year, just to continue to inform the skilled nursing facilities of why we're doing what we're doing, how it's connected to our goals and our budget. So we've used that if we've had pushback from skilled nursing facilities of like, hi, this is why we're doing it, along with the Department of Justice findings letter. And that has been pretty helpful in getting the skilled nursing facilities to schedule with us. So if there are any tools that I did not list here that you would like or think would be helpful for us to develop, please let us know. Our team has been pretty diligent on trying to see what works and what doesn't work, but we also have only been doing this for the past year. So we're open to feedback and how we can continue to support the program's growth. Okay. And I think I had one question in the chat. Maybe. Jennifer said that they only update their resource annually. So yeah, we can definitely take that back and have a conversation with our leadership to see if we can change that around a little bit. And so the presentation, we can have that uploaded by this week so that you all can review it. And then, like I said, we would like for you all to have your presentation back to us within 30 days of the contract start date. So that would be the end of July. if we can get those contracts signed and through the process. So, all right. So this last slide right here is going to be just a table of the deliverables and the due dates. This, of course, will accompany your contract, but I just wanted to take a screenshot of it and have it posted so you can see it. We tried to keep most of the stuff due on the 15th. Unless it was something that you all were doing previously, then we tried to leave it the same. So anything that you're doing for options counseling, that is going to stay the same. Okay. And then are there any questions about any of those deliverables? I'll let it hang for a little bit so that you all can review it. Okay. And we will post this presentation so that you all can look at it again. And then also later on this week, the actual recording of the presentation will also be posted. So, all right, well, that is the end of the presentation. Are there any questions about anything that I talked about today? Anything that you would like me to clarify? It looks like Neil has his hand raised. Go ahead, Neil.
Hi, thank you. I did have a question for the deliverable. If we're inviting family members to attend, are we recording their attendance as well?
Yes, you would record them as a natural support. We do not need their name. We just need to know how many of them attended. So if you have one member and they brought 3 family members, we're going to just count them as the 3 that attended alongside, and there will be a space in the deliverable for that information.
Okay, great. Thank you.
Thank you, Neil. And I know we've had these conversations kind of ongoing. And so if you all need time to kind of just think through it, review some of the documents, please reach out to anyone on the team. We're happy to help and answer those questions or find the answers if we need to. So. Yep, Tiffany, we'll try and get those posted as soon as we can so that you all can review them and, like you said, really dig into them and see if they're going to benefit your needs and help with the program, or if there's some things that we need to adjust. So we look forward to hearing your feedback on those, and we'll try and get them out to you all as soon as possible. All right.
Will we be receiving an email with when those are available, or?
Yeah, we can send out an email. I probably would send it to the same group that I sent the memo to, and then they can disseminate it to everyone. If there's anyone specific that I haven't been reaching out to directly that I need to, let me know. I've been trying to keep an update of direct contacts that we need to include in our communications. So we will definitely get that out to you. We'll send it via email and we'll upload it to SharePoint.
Thank you very much.
Of course. And so this is our contact information. That first email is going to be for comments, questions, concerns, skilled nursing facility interference. You can also reach out to me directly. But like I said, it's probably a lot easier to reach out to the top one because the team has access, so you don't have to worry about if I'm in or out. But I'm more than happy to take emails as well. If you do need to update your SharePoint, you will need to email me directly and I will take care of that. All right. So if there are not any other questions, that is the end of Group Enreach training. We look forward to continue working with you all, and let us know if you have any questions, concerns, or needs.
Thank you, Chanel. Have a good day.
Thanks.